How much iodine for Hashimoto's? We've been talking about this one for a long time. As long as I have known Dr. Datis Karazian and have been going to his classes, who I think was the first one who came out and said no iodine for Hashimoto's, and kind of blew up the alternative thyroid world, because up until then everybody was giving iodine for thyroid disease. And back then that was because most people were not being diagnosed with Hashimoto's. Ever since then, I've never given anybody iodine. And since then, the number of studies that have come out to back that up has probably more than 50. And yet, I had a colleague who specializes in Hashimoto's and goes to all these same classes. And he called me the other day and said, "You're not going to believe it. I went to this class from a reputable, I think reputable, group." So I'm not going to name their name right now, though, because they were teaching during the group to give Hashimoto's patients iodine. The evidence is crystal clear. No iodine. When the confusion is you need iodine to make T3 and T4. If you're watching this video, I'm assuming you know T3 and T4 are the thyroid hormones. If you don't know that, T3 and T4 are the thyroid hormones. And they're made out of, so the T is tyrosine, so this is a chemical, right? T is tyrosine, and then the 4 is 4 molecules of iodine. And then the 3 is 3 molecules of iodine. So it's made out of iodine. There's this enzyme called thyroid peroxidase, enzyme peroxidase. So it takes hydrogen peroxide out of your system. It sucks iodine out of your blood, it puts them together, and that's how you make thyroid hormone in your thyroid. So logically, you would say, okay, I need iodine. But what happened was this Hashimoto's. I don't think it's just that Dr. Karazian started to be the first doctor to say, listen, all of this is Hashimoto's. All these hypothyroids are Hashimoto's, and the Mayo Clinic agrees with this now. And I think because I've been doing this for a long time now, and it just seems to be exploding. It's starting to go through, Hashimoto's is exploding. It's going through generations. We're starting to see it in 2 and 3 and 5 and 7-year-olds. It's pretty scary, frankly. But the bottom line is I would say it's probably a relatively new issue over the last 20 years or so. And so prior to that, it was mostly hypothyroid. So people gave people iodine, they felt better because they had low iodine, they weren't making enough thyroid hormone, they felt better. But if you take it when you have Hashimoto's, the thyroid peroxidase enzyme that I talked about now starts getting more fuel from another source. So it's taking iodine out of your blood to make this T4, but now you're giving it iodine. Well, it doesn't need more iodine because so if you give it more iodine, it's going to start making more thyroid hormone. And classically, people are going to get jittery, they're going to get anxiety, they're going to get heart palpitations, they're going to get things like that. And they're not even going to realize that it's the iodine. And the iodine's in what? The iodine's in seafood. It's really big in shellfish. It's really big in shrimp. It's in kelp. So you have these nice salty kelp treats from Costco. I happen to know because my wife buys those, and they're very good. And I have to resist them because I have Hashimoto's, right? And you get it from a lot of you. A lot of you are women. Most 10 to 1 women get Hashimoto's. A lot of the women's multivitamins have iodine in them, and different people react to it differently depending on how severe their case is, or maybe how sensitive they are to the iodine. But I've had just enormous success with taking iodine away from everybody. And some people were just like, "Oh my God, I got rid of the iodine." It's like I'm like 80% of my symptoms are gone. Others are like, "Yeah, I feel a little bit better." Others are like, "Well, I don't know," because there's 39 different triggers. But they still need to stay off of it, because if they're not feeling it now, but they keep eating the iodine and that keeps damaging thyroid tissue over a period of time, you're going to pay for it. And autoimmunity doesn't go away, so it's something that you really, 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 even if you get off the iodine, you go like, look, I don't feel any different, and my homeopath told me I should be on iodine. Listen to me, you should not be on iodine. And I mean, there's some really cool studies on this that are just mind blowing. And I'm not talking small studies. I'm talking like studies of whole countries who went off of who were given iodine because they weren't getting enough in their diet, and they all had these goiters. I mean, I want to say like Ethiopia, not to pick on Ethiopia, but I think it was Ethiopia. And then they all had these goiters, and so if you get the iodine, the goiter will go down. However, they all started developing Hashimoto's. It was a huge, 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 huge study. That's just one. So no iodine. Iodine is contraindicated. It is one of the 39 triggers, and I would probably put it up there, like right next to gluten, as far as like the hierarchy of like the worst triggers. It's up there at the top.